You wake up in the morning, something feels off, a mild headache, your vision seems slightly blurred, your fingers feel a little tingly. Most people say, it's nothing, just age, or I probably slept wrong, but I'm Dr. Raymond Cole. I've spent over 20 years treating stroke patients in emergency rooms, intensive care units, and rehabilitation centers. And I can tell you that these subtle morning symptoms are often the only warning signs that a stroke is about to happen or has already started. I've sat with families who said, if only we had known. I've watched patients lose the ability to speak, to walk, to recognize their own children, all because a warning sign was ignored. Today, I'm going to reveal 5 morning symptoms that seniors must never ignore because recognizing them early can save your life or the life of someone you love. This isn't about scaring you. It's about giving you the knowledge to act fast, because when it comes to stroke, every minute matters. Let's get started. Let me start with something most people don't realize, something that could save your life. Strokes are most common in the morning. Large-scale studies, including one published in the journal Stroke, have shown that the risk of stroke is about 50% higher between AM and noon compared to the rest of the day. Why? Because when you wake up, several dangerous things happen in your body. First, your blood pressure naturally surges. It's called the morning surge. After a night of lying down, your body releases stress hormones like cortisol and adrenaline to get you ready for the day. Those hormones raise your blood pressure. For a senior with already elevated blood pressure, that surge can rupture a small blood vessel in the brain or dislodge a clot. Second, your blood becomes thicker and more likely to clot overnight because you haven't been drinking water for 6 to 8 hours. Dehydration increases blood viscosity. Third, in people with atrial fibrillation and irregular heart rhythm, the morning hours are when the heart is most likely to throw a clot into the bloodstream. So the morning is a perfect storm for stroke. But here's the problem. The early warning signs of a stroke are often subtle. They don't look like the dramatic, one-sided weakness you see on TV medical dramas. They feel like everyday complaints: a headache, a bit of dizziness, a touch of confusion, and because they happen right after waking, many people ignore them or blame a bad night's sleep, a stiff neck, or low blood sugar. By the time the full stroke hits, it's often too late for the best treatments, like clot-busting drugs, TPA, or mechanical thrombectomy. That's why I want you to memorize these 5 morning symptoms. If you or a loved one experiences any of them, you must act immediately, not wait to see if it passes or rest for an hour. I'll also tell you exactly what to do at the end. The first morning symptom to never ignore is sudden, severe headache, especially one that feels different from your usual headaches. I'm not talking about a mild tension headache that fades after coffee. I'm talking about the worst headache of your life, often described as a thunderclap that peaks within seconds or minutes. Patients say, it felt like someone hit me in the head with a baseball bat, or I thought my head was exploding. This can be a sign of a hemorrhagic stroke, bleeding in the brain, often from a ruptured aneurysm. But here's the critical point. Even if the headache fades after a few minutes, it could be a sentinel headache. Warning that an aneurysm is about to rupture completely. Studies show that up to 40% of patients with a ruptured brain aneurysm report a sentinel headache days or weeks before the major rupture. That headache is your brain screaming for help. If you wake up with a headache that is unlike any you've had before, especially if it comes with nausea, vomiting, or sensitivity to light, do not take an aspirin. Aspirin can worsen bleeding. Do not go back to sleep. Call 911 immediately. I had a patient, a 67-year-old woman named Carol, who woke up with a thunderclap headache. She thought it was a migraine. She took ibuprofen and went back to sleep. 3 hours later, her husband found her unconscious. She had a massive brain bleed. She survived but was left with permanent memory loss and difficulty walking. If she had called an ambulance immediately, surgeons might have been able to clip the aneurysm before it fully ruptured. The second morning symptom is sudden dizziness or loss of balance. Many seniors wake up feeling a little off, a little unsteady when they get out of bed. They blame their inner ear benign paroxysmal positional vertigo, or BPV, or low blood pressure from medications. And yes, those are common causes. But if the dizziness is severe, enough that you feel like the room is spinning, vertigo, or you cannot walk straight without holding onto walls, or you feel like you might fall when you stand up, that could be a stroke in the brainstem or cerebellum. These are often called posterior circulation strokes, and they don't always cause the classic facial droop or arm weakness. The fast test face, arm, speech, time misses these strokes entirely. I've seen patients sent home from urgent care with a diagnosis of vertigo when they were actually having a stroke. They came back days later with permanent disability. So if your morning dizziness comes with any of these additional symptoms, double Vision, difficulty swallowing, slurred speech, or a new unsteadiness that feels like you're drunk, it's a stroke until proven otherwise. Do not let anyone tell you it's just an ear problem without a thorough neurological exam and a brain MRI. The third morning symptom is sudden vision changes in one or both eyes. You wake up and it seems like a dark curtain is falling over one eye, or you see double two of everything, or your vision is blurry, but it doesn't clear when you blink or rub your eyes, or you have a blind spot that wasn't there yesterday. This can be a transient ischemic ataxia or mini stroke affecting the blood vessels to the eye or the visual processing centers in the back of your brain. The medical term is amaurosis fugax when it's a temporary loss of vision in one eye. Many seniors dismiss this as needing new glasses or simply having old eyes. But a TIA is a medical emergency. It's a warning that a full stroke may follow within hours or days, a landmark study. In the New England Journal of Medicine found that up to 20% of people who have a TIA will have a major stroke within 90 days, and about half of those happen within the first 48 hours. If you wake up with sudden vision changes, do not wait for an eye appointment, do not call your ophthalmologist, go to the emergency room immediately. I remember a 71-year-old man named George who woke up with a shadow in his left eye. He thought his glasses were dirty. He cleaned them, but the shadow remained. He went back to sleep. When he woke up again, his entire left side was weak. He had a major stroke. His wife later told me he mentioned his vision was funny, but we didn't think it was serious. That's why I'm telling you now. Vision changes in the morning are serious. The fourth morning symptom is sudden confusion or trouble speaking that seems worse in the morning. You might wake up and feel foggy, not able to find common words, not understanding what your spouse is saying, feeling disoriented about where you are or what day it is. You might try to speak, but the words come out wrong. I need to walk the dog comes out as I need to fork the tree. Families often think mom is just tired or she has a urinary tract infection. And yes, UTIs can cause confusion in seniors, especially those with underlying dementia, but a new, sudden confusion, especially in the morning, is stroke until proven otherwise. The brain's language centers are very sensitive to lack of blood flow. If a small clot blocks a branch of the middle cerebral artery, you can lose the ability to speak or understand speech. This is called aphasia. Some patients are aware that they're not speaking correctly. They get frustrated, emotional, angry. Others have no idea. If your loved one seems confused, ask them to repeat a simple sentence. The sky is blue. If they can't, or their speech is slurred, or they seem to not understand you, call 911 immediately. Do not pass go. Do not collect $200. I had a 74-year-old patient, Eleanor, whose daughter called me because mom is just not herself this morning. She was able to speak, but she was repetitive, asking the same question every 2 minutes. Her daughter thought it was sundowning or a UTI. I told her to go to the ER. It was a stroke in the temporal lobe. Eleanor received TPA within 3 hours and made a full recovery. Her daughter's quick action saved her. The fifth morning symptom is sudden numbness, tingling, or weakness on one side of the body. This one is more recognizable, but many people ignore it when it's mild. You wake up and your left hand feels asleep or heavy. You think you slept on it wrong, or your foot feels numb, and you think it's your sciatica acting up, or your face feels weird on one side when you brush your teeth. Here's the difference. Stroke symptoms are sudden, they come on within seconds or minutes, and they affect one side of the body in a characteristic pattern. If you can't lift your arm equally on both sides, or if your smile is crooked, or if you drop your coffee cup in the morning, that's a red flag. The classic FAST test is helpful. F for facial drooping, A for arm weakness, S for speech difficulty, T for time to call 911. But remember, strokes can be subtle. Sometimes the weakness is only in the hand or only in the foot. Sometimes it's just clumsiness. But if you notice any new one-sided weakness or numbness, especially if it comes on with other symptoms like headache or dizziness, do not wait to see if it passes. Call for help. Let me tell you about a patient I'll call Robert. He was 68, a retired carpenter, healthy, walked every day, managed his blood pressure with a single pill. One morning he woke up with a slight headache and felt a bit dizzy when he stood up. He thought it was his blood pressure medication. He sat on the edge of the bed for 5 minutes, then went to make coffee. By the time he reached the kitchen, his left arm felt heavy. He dropped the coffee pot. His wife heard the crash, came in, and saw his face looked a little droopy on the left side. She didn't hesitate. She called 911 immediately. Robert arrived at the hospital 45 minutes after symptoms started. The CT scan showed no bleeding. The stroke team administered TPA tissue plasminogen activator, a clot-busting drug. Within hours, his symptoms resolved completely. He went home after 3 days with no disability. He's now back to woodworking and playing with his grandkids. His wife's quick action saved his life and his independence. Now contrast that with another patient, Margaret. She was 73, lived alone, independent. She woke up with blurred vision in her right eye. She thought her glasses were dirty. She cleaned them, but the blurriness remained. She went back to sleep, thinking she just needed rest. When she woke up again, she couldn't speak. Her daughter called for a welfare check when Margaret didn't answer the phone. Paramedics found her confused and unable to move her right side. By the time she got to the hospital, it was too late for TPA. The window had closed. Margaret survived, but she spent 6 months in a rehabilitation facility and never regained full use of her right hand. She couldn't return to her volunteer work at the church. She became dependent on her children for daily tasks. The difference between Robert and Margaret was just a few hours. That's why you must act. So what should you do if you or a loved one wakes up with any of these 5 symptoms: sudden headache, dizziness, vision changes, confusion, or one-sided weakness? Here is your action plan, step by step. First, do not call your primary care doctor's office. They will tell you to come in or go to the ER, wasting precious minutes. Do not drive yourself to the hospital. You could have a stroke while driving. Call 911 immediately. Ambulance crews can begin stroke assessment on the way. Check your blood sugar and oxygen and alert the emergency room so a stroke team can be ready for your arrival. Second, note the time the symptoms started or the last time you were known to be normal. This is critical because TPA must be given within 4.5 hours of symptom onset, and mechanical thrombectomy can be done up to 24 hours in select patients. If you don't know the exact time, give your best estimate. Third, do not eat or drink anything you may need procedures that require an empty stomach. Do not take aspirin, ibuprofen, or any other medication unless told to by emergency personnel, because if it's a bleeding stroke, aspirin can be deadly. Fourth, when emergency services arrive, say these exact words: I think I'm having a stroke. My symptoms started at time. I have list symptoms. Be clear and direct. Fifth, bring your medication list, your insurance card, and any important medical information: allergies, medical conditions, recent surgeries. At the hospital, they will likely do a non-contrast CT scan to determine if the stroke is from a clot ischemic or bleeding hemorrhagic. If it's ischemic and you're within the time window, TPA can dissolve the clot. In some cases, if there's a large clot, they may perform a mechanical thrombectomy, removing the clot with a catheter threaded through an artery, which can be done up to 24 hours after symptom onset in carefully selected patients. The sooner you arrive, the better your outcome. Don't let fear or doubt keep you from calling. Now let's talk about how to prevent strokes in the first place, because the best treatment is never having one. After 60, your risk of stroke doubles every decade. But you have enormous power to reduce that risk by up to 80% with lifestyle changes and proper medical management. Here are the 9 most effective prevention strategies based on the latest guidelines from the American Heart Association and American Stroke Association. Number 1, control your blood pressure. High blood pressure is the single biggest risk factor for stroke, responsible for about half of all strokes. Aim for a target that your doctor sets, usually under 130/80ths for most seniors, but individualized if you're frail or have other conditions. Take your medications as prescribed and check your pressure at home with a validated upper arm cuff. Even a 10-point reduction in systolic pressure can cut your stroke risk by 40%. Number 2, if you have atrial fibrillation, AFib, and irregular heart rhythm, you need blood thinners. AFib increases stroke risk 5-fold because blood pools in the upper chambers of the heart and forms clots. Discuss with your cardiologist whether you need a blood thinner like apixaban aliquis, rivaroxaban Xarelto, or warfarin Coumadin. These medications reduce stroke risk by 60-70. Number 3, stop smoking. Smoking damages blood vessels, increases blood pressure, and makes blood more likely to clot. It doubles your stroke risk. Within 5 years of quitting, your risk drops to that of a non-smoker. Number 4, control diabetes. High blood sugar damages small blood vessels throughout the brain. Keep your A1C under 7% if possible through diet, exercise, and medications. Number 5, manage your cholesterol, especially LDL. Statin medications not only lower cholesterol but also reduce inflammation in artery walls, preventing plaque from rupturing and causing a clot. Most seniors with diabetes, heart disease, or previous stroke benefit from a moderate or high-intensity statin. Number 6, exercise daily. Even a 20-minute brisk walk 5 days per week reduces stroke risk by 20-30. Exercise lowers blood pressure, improves cholesterol, helps with weight control, and reduces inflammation. Number 7. Eat a Mediterranean-style diet. That means plenty of vegetables, fruits, whole grains, nuts, legumes, fish, especially fatty fish like salmon and sardines, and olive oil. Limit red meat, processed foods, added sugar, and salt. This diet has been shown to reduce stroke risk by 30% in large clinical trials. Number 8. Maintain a healthy weight. Obesity increases stroke risk through multiple mechanisms. It raises blood pressure, cholesterol, and blood sugar, and promotes inflammation. Losing just 5–10 of your body weight can make a meaningful difference. Number 9. If you have sleep apnea, treat it. Severe obstructive sleep apnea increases stroke risk by 2 to 3 times, independent of other risk factors. SPAP therapy, a mask that delivers pressurized air while you sleep, can dramatically reduce that risk, as well as improve your daytime energy and blood pressure control. I also want to emphasize the importance of knowing your numbers. Have a primary care doctor who checks your blood pressure at every visit, does annual blood work for cholesterol and blood sugar, and listens to your heart for irregular rhythms. If you've had a TA or minor stroke in the past, you may also benefit from antiplatelet medications, like aspirin or clopidogrel Plavix, but never start aspirin on your own. For some seniors, the risk of bleeding outweighs the benefit. Your doctor can help you decide. Let me leave you with this. Stroke is the 5th leading cause of death in the United States and a leading cause of long-term disability. Every 40 seconds, someone in America has a stroke. Every 3.5 minutes, someone dies from one, but up to 80% of strokes are preventable. The morning symptoms we discussed today are your early warning system. Pay attention to them. Share them with your family. Post the Be Fast mnemonic on your refrigerator. Balance loss, eyesight changes, face drooping, arm weakness, speech difficulty, time to call 911. If you see any of these signs, even if they seem minor, even if they come and go, do not wait. Call emergency services immediately. You have the power to save a life, maybe your own, maybe your spouse's, maybe your parents'. Before I say goodbye, I must give this important disclaimer. Everything in this video is for educational purposes only and is not a substitute for professional medical advice. If you or someone near you experiences any sudden neurological symptoms, even if you're not sure, seek emergency medical attention immediately. Do not delay. Based on this video, your personal health situation may vary, and only a physician who examines you can make a diagnosis. I'm Dr. Raymond Cole. Every morning, millions of seniors wake up with subtle symptoms that could be the first sign of a stroke. Most ignore them. You won't anymore. Please share this video with everyone you love, especially those over 60, especially those with high blood pressure or diabetes. That one share could save a life, the life of a parent, a grandparent, a friend. Hit the like button if you learned something new, and subscribe to Senior Health Hub for more honest, life-saving information every week. Next week, we're talking about the 5 foods that trigger strokes and the 3 that prevent them. Stay aware, stay alive, and I'll see you in the next video.